Hello. I wanted to chat with you today about ICL, so intraocular Collamer lenses, or intraocular contact lenses, as some call it. This is a great option for anyone who's nearsighted, who has astigmatism. It corrects both. And it's best for patients who are 20 to about 40 years old, but it can also be for patients greater than 40 years old. And we can talk about some of the special considerations for patients who are a little older than 40. So first of all, some background on ICLs. They've been around since 1996. They've gone through many iterations, and the newest one, called the EVO ICL, just was released about a year and a half ago, and it's been very successful. This EVO ICL and Vision ICL, the previous version, has been just game changing on the East Asian market. And if you don't know, East Asians, such as myself, often have really high prescriptions. About 80% of us are high myopes, which means that our glasses prescription is greater than 6 diopters for nearsightedness. And the reason is because when you're at that high of a prescription, when you do LASIK or PRK, you're really removing a lot of tissue from your cornea, and you can induce dry eye, you can induce aberrations on the cornea, which later can affect your lens choices for refractive lens exchange or cataract surgery. But the ICL, the great thing is it's additive. So we don't remove any tissue at all. And we just add this lens and restore your vision to better than it was in glasses. Um, my patients, my happiest patients are ICL patients. They're really just stunningly happy by the day after surgery. Typically, my patients are 2020, if not better. Some patients are 2015, others are 2010. Um, so it really can get you that full potential of what your vision can be. And because this lens is deep inside the eye, it can bypass a lot of the aberrations that you would experience when you wear, for instance, glasses. And so some of you have noticed that your glasses have a lot of rings on the outside. Well, the rings cause those aberrations, and they can kind of distort your vision, either give it more of a barrel shape or kind of a, pincushion shape, depending on if you're nearsighted or farsighted. But these lenses exist inside the eye, so and they have far greater uh, peripheral vision coverage, so you're not expected to see those distortions at all. And that's just a fact of optics. The more inside your eye you get, the better the optics and the less the distortions. The newest one, called the EVO ICL, has been built with more safety in mind. So this lens will prevent you from having premature cataracts, and it will prevent you from having uh, pressure-related issues. So basically, it's as safe as it can get, and we haven't to date seen any or heard of any issues in the literature or in our own practices. And by the way, our practice has done the most ICLs in America and with the highest success rate. So we only have about 1 in 400 patients who need a retouch of anything after ICL surgery with us. Um, and you can look at my ICL surgeries on this channel, but it is it's an absolutely painless surgery. It takes about 2 or 3 minutes to do per eye. And it's blurry vision after surgery because of the dilation, but by the next day, just really, really, really good vision. Um, so one thing I wanted to do in this video is to kind of describe the process of ICL surgery, and then also to compare ICL to LASIK and PRK surgery. A lot of questions I get from patients are revolve around those issues. So ICL surgery, uh, like I said before, takes about 2 to 3 minutes to do. Essentially, we just make a small nick on the cornea, and we insert this lens through that little small nick, and it unfolds and glides right behind the iris, the color part of the eye, which is where it'll stay. Like I said before, it can treat astigmatism as well. So for astigmatism treatment, we just rotate that lens and align it to the axis of your astigmatism to neutralize it. Um, and we said that by the day after surgery, you'll be very pleased. And my happiest patients are ICL patients. Because it doesn't take any adaptation for the brain. You're going to see distance all the way up to up close, as close as you want to see, um, all by the day after tomorrow, after surgery. Um, so let's talk about the comparison between ICL and LASIK. And first of all, let's talk about range. ICLs are designed for nearsighted patients. Okay, so we don't have an option for farsighted patients. Typically at the age of 20 to 40, farsighted patients still get by okay. You can through the process of accommodation, which is increasing the power of your lens inside your eyes. And you have a very flexible lens when you're young. You can bypass that farsightedness. That goes away by age 40 or so. Um, but there's just really you don't have much demand for ICLs at the age between 20 and 40. Um, so for ICLs, we can treat up to 20 diopters of nearsightedness. That's a lot. For LASIK, to give you an example, LASIK can treat up to about 8 diopters of nearsightedness, and PRK can treat up to 9 or 10 diopters of nearsightedness. So ICLs can treat double that amount. So if you're really nearsighted and LASIK was never an option for you, well, this surgery will be a great option. The next question I get often is, well, what about dry eye? Dry eye is often brought up during LASIK surgery, and the reason we get a little bit of dry eye from LASIK is because we're removing tissue very close to the front of the eye, and that's where most of your nerve endings are on your cornea. And the cornea, the front part of your eye, is the most sensitive part of your body. So when you remove a lot of those nerves, they do grow back to some extent, but for some patients, they don't fully grow back. And so that will blunt that blink reflex or our ability to protect our eyes by closing and basically, rehydrating the eyes through blinking. So if you lose a lot of those nerves on the front, you will blink less and you will feel less on your cornea. So that in the long run can lead to dry eye. Well, that's no problem for ICL because we don't remove any tissue on your cornea. Your cornea will stay as sensitive as it's always been. Um, yes, the surgery is inside the eye, so it has nothing to do with the sensation of your cornea or anything on the surface. Um, and a lot of LASIK patients for a good amount of time will feel like their eyes are gritty. And that's again because a flap is made on your cornea. And again, none of that happens with ICL surgery. So you should feel back to normal by the day after surgery. Um, the next consideration to compare LASIK and ICL is what happens when you're older? Let's say now you're 50 years old and the lenses inside your eyes are starting to fail. They can no longer focus light. Um, and at that point, all of us will need to start considering a lens-based surgery to replace the lenses inside our eyes. And in the future, if you decide to delay that and opt to do cataract surgery in your 80s or so, um, well, there are implications, particularly for LASIK surgery, right? So when you do LASIK surgery, you reshape the cornea, but effectively only the central part of the cornea, just the central 6 millimeters 6 to 6.5 millimeters. The rest of your cornea you leave alone. So effectively, that creates a multifocal cornea. You have central power that you've reshaped, and then the peripheral power. Um, that decreases something we call contrast sensitivity. So a multifocal cornea, we know not to pair with a multifocal lens. So if you had LASIK surgery, it limits you um, you know, to just extended depth of focus lenses or monofocal lenses. Often we recommend the light adjustable lens for post LASIK or PRK patients. Well, that's not an issue for ICL. We simply remove the ICL, and it takes less than 30 seconds to remove this lens. And then we go about your surgery as if you never had an ICL or never had any prior surgeries. And you can choose, if you wish, diffractive multifocal lenses, refractive multifocal lenses, light adjustable lenses, anything that you want when it comes time for your refractive lens exchange or cataract surgery. The other difference between ICL surgery and LASIK surgery is that the ICL has UV protection built into it, almost 100% UV protection. When you add a lens, you get to add, safety features into it, right? But when you take away from the cornea, you don't have that ability to block the UV light. So you would still need to wear protective glasses under the sun. Healing time. So healing time for ICL surgery, like I said, is very happy the day after surgery. And that's also true for LASIK. For PRK, it takes longer. It takes about 4 to 8 weeks, and that's because of the healing process for PRK. These days with ICLs, it will be very, very seldom that any refractive surgeon offers you PRK. It just, you know, nobody wants to go through that amount of pain and that amount of recovery time, and then to have poor vision for 2 months while you wait for the recovery. Um, And lastly, I think this is probably the best feature, and I've touched on this a few times, is the reversibility. So ICL, as we've talked about, is reversible. We can explant it. It just takes 30 seconds to explant this lens. Um, to my knowledge, nobody has had this lens explanted unless it was a fit issue. It was the sizing was too big or too small. But patients love this lens, and it will be a shock. You'd be probably the first if you decided, hey, I don't like this lens. Please take it out of my eye. I'm going to go back to glasses. I've never heard of anyone. Of course, it's been done for longer in Asia, and the ICL controls the Asian market. So maybe, a few patients in China or Japan or South Korea, maybe for whatever reason they had it explanted. But in America, to my knowledge, there's nobody who's come out of an ICL. Um, so I think that about covers everything a patient typically asks me. So now I'm going to just jump into a few things that you may want to know, but you may not care to know. One is that ICLs have very strict boundaries for which eyes they can be implanted into, and that comes from the FDA's guidance for how to use these lenses. America is particularly strict with through its FDA and its FDA recommendations. But if you go elsewhere, say if you cross the border into Canada, well, a lot of these guidances, don't apply. And especially if you go to Asia, different eyes. Asian eyes tend to be smaller from, the width perspective, and longer from the anterior posterior perspective. So different types of eyes. So they have different guidances depending on which country, gave the approval. That being said, most of us have a lot more experience with Asian eyes, doing the surgery in Asian eyes, and that's sort of our heavily focused on that in our San Francisco market. Um, so from that experience, we can do any eye really. Sometimes we'd have to go off label, which means the FDA says, the anterior segment has to be a certain depth. And beyond that certain depth, it's up to the doctor to recommend or not recommend the ICL. We haven't found an eye that's not been able to tolerate the ICL because of limitations on the anterior chamber depth. So we can always find the right sizing for you, but just sometimes we have to go off label, which just means the doctor gets to make that call, and the FDA and the doctor gets to set aside the FDA's parameters. The other parameter that sometimes you may choose with your doctor's guidance uh, to bypass is that the ICL is the FDA has approved it for patients who are aged 20 to 40. And the reason why you'd want to have a more in-depth conversation with your doctor beyond the age of 40 is because there are going to be lens changes inside your eyes. So as all of us get into our mid 40s or so, the lens inside our eye is going to start to fail. It's going to start to not be able to focus the light to be able to give you that range of vision that you're accustomed to when you're young. So as that starts to happen, the ICL may only be able to get you your distance vision, and it may not be able to, sufficiently get your near vision, particularly if you're closer to 50 years old. And one way to go around that is to offset the two eyes with the ICL. So in the dominant eye, you would choose to have a distance target, and in the non-dominant eye, we can give you a boost for your near vision, and we call that blended vision. And while that near eye will get you reading much better, it doesn't really sacrifice a whole lot of your distance vision. I'd say maybe just one or two lines, you'll still be about 20/25 or so. Um, that about covers everything you need to know about ICLs. I guess just to summarize, this is a very, very uh, good surgery. I personally think it's much better than LASIK, SMILE, or any of those surgeries that are permanent and requires removing tissue from your eye. So I only do ICLs. I seldomly do LASIK or small surgeries. Um, and it preserves your options for clear lens exchange later on in life. And so then you'll have the ability to choose multifocal lenses that will restore your full range of vision back to you in your 50s and beyond. Um, and this surgery will not cause any dry eye. You may have dry eye already, and so you'll still have dry eye afterwards. But if you didn't have dry eye, well, no, you won't have dry eye afterwards because again, it doesn't disturb the surface of your eye. Um, I think that about covers it. Thanks for listening to my discussion and my experience with the ICLs. You can look on my channel if you're interested in seeing, how that surgery is done. There should be, dozens of those surgeries posted on my channel. Thank you for listening. Oh, and I 3D printed an ICL lens. It was more for me to uh, do a little bit of modeling on how this lens fits behind the iris and around the ciliary body. But I just wanted to share you. It doesn't. It's not white, obviously. It's as clear as a contact lens. It's much softer and thinner than a contact lens. But anyways, I like 3D printing, and thank you.